Welcome to Autism Approved, brought to you by Enzymedica. Now here's your host, Kristen Selby Gonzalez.
Hi, and welcome to Autism Approved. I'm your host, Kristen Selby Gonzalez. Right now, we are currently in Tampa, Florida, where we are at the yearly National Autism Association Conference, and we're very excited to talk to a very well-known doctor who is a presenter here, Dr. David Berger. If you missed this conference and you missed his presentation, I highly recommend you guys going to the website at www.nationalautismassociation.org. Well, welcome, Dr. Berger.
Thank you.
Thank you for being here. I know
Absolutely.
It's exciting because so many parents can't be at these conferences, and there's so many great doctors and great therapists doing amazing work. And I know you have a little bit of a different approach that you use, right?
Yes.
And you call that holistic, but it's spelled with W, right?
That's correct, right.
Can you maybe define that a little bit?
Certainly. Well, I spell holistic pediatrics with a W because the word WHOLE looks at the whole patient, okay? And to me, if you don't take everything into consideration from what's happening at home and the structure and the support that the parents have, to what's happening educationally, to what's happening with the child's sleep, to really every aspect, then we're missing some very big points, which happen not just educationally but therapeutically. So all these things go into making the whole. And so if we're not taking care of all those things, then one thing being off could really take back a lot of the other things that we're trying to accomplish. So we need to kind of look at all of those things all at once in order to make a full, hopeful, best recovery.
And to be able to treat the entire child or entire person, because
Absolutely.
We see children a lot, but really that means 2 to 92, right? It doesn't really matter.
Yeah, and actually my wife kind of is telling me I need to change the tagline of my practice to treating children and their families, because I actually have quite a large growing adult population in my practice. It first started off with patients' parents, who we would do biomedical work with them, and then the mom would talk about her depression or her anxiety or her arthritis or other things going on in the family. And then so I started seeing adults, and as well as for their GI issues and their autoimmune issues. And so my general rule of thumb as a pediatrician is that if an adult has a condition that kids also get,
Absolutely.
then I'm very comfortable treating that, because humans are still humans.
And it doesn't matter at what age, right?
But if a woman's asking me to help her with her menopause, or
That's a
a man's
different.
asking about her prostate, then that's definitely different. Then I will kindly refer them elsewhere. And I guess maybe the one caveat, or if I've done it to myself and my family, so my parents, so they're my guinea pigs. So there are certain things that I'm comfortable on basic stuff. I certainly wouldn't be comfortable managing blood pressure medications, but certainly there are things from a general nutritional holistic perspective, like blood sugar regulation and cholesterol and high blood pressure. There are things from a more natural and exercise perspective that I feel very comfortable doing, but I'm also tell every family and every patient, I'm not embarrassed or afraid to say I don't know or you should look elsewhere, and I would never cross a line with them. That if I wasn't comfortable, I will let them know that. I won't make something up just to make them feel good walking out the door. They need to know, I know what my limitations are, and I would never want to lead somebody down the road thinking that I knew what I was talking about if I didn't.
Well,
unfortunately, and that's unfortunately I think something that not all doctors do. A lot of doctors seem almost afraid to say the words I don't know.
Well, that's a sign of a good doctor, I think, right?
I would tend to think so, yeah.
Now, what inspired you to start working with children on the spectrum?
Well, it really actually came back more to my interest in holistic medicine in the first place. So when I was doing my residency at Tampa General Hospital, which was back in the mid-90s, and back then was really when information was coming out about not using antibiotics for every little thing that happens, for the importance of breastfeeding, not using over-the-counter cold medications, not reducing fevers. And we were taught actually a rather holistic of what not to do, which was really flying in the face of what was taught 10 years prior. And at that time, I was also left with what can I do? And then a journal article in one of our pediatric journals came out called 7 Herbs Every Pediatrician Should Know About. And it was written by a pediatrician who at the time was in Seattle, who had just been hired at Harvard to start the first holistic pediatric department at the university level. And she had a book called The Holistic Pediatrician. Her name is Dr. Kathy Kemper, who's now at Wake Forest. And so when I went to the department chair and I said, would it be okay if I use these treatments in our clinic? And their answer was, and the journal that she published in was an Academy Pediatrics journal. And they said, well, if it's in contemporary pediatrics, this journal, absolutely, because that's that's us. You know, you could definitely do it. So I wasn't doing special needs biomedical things, but just basic things like using echinacea to support the immune system, using probiotics, using chamomile for upset tummy. It's just really basic stuff. And then when I left my residency and I was using them more and more, then families with autism started seeking me out because they would hear about diets, they would hear about natural things. They couldn't find many pediatricians who would either support them or talk to them about these things. So, and again, I didn't have much knowledge in those things at the time, but I've always felt that a parent knows their kid better and I should support them in their quest, and I'd be happy to learn together with them. So at first it started off with, well, we hear about this dairy-free, wheat-free diet. Can you help us with that? Make sure that our kid gets enough calcium and protein. Sure, we could do that. Hey, I heard about these tests that we could do to look for candida yeast. Will you order them for us? Well, I don't know how to interpret them at the time, but certainly, you know, the use of antifungal medications is well documented in pediatrics. So sure, I could figure out what the proper oral dose of fluconazole would be, and certainly I can put your kid on probiotics, etc. And then we started getting more and more in. So I actually was doing these types of tests and treatments, having no idea that there was the Autism Research Institute, no idea there was Defeat Autism Now, and other physicians around the country who was doing this. And then about a year into this, one of my patients said, you know, there's this Dr. Jeff Bradstreet up about 2 hours north of us, and like, you guys are doing the same thing. It's amazing you don't know each other. And she gave me his webpage, and I went to it, and he had this like 62-page manifesto of all this research and his thoughts and everything, and it was really right with what I was doing at the time. And I was like, oh my God, there's other physicians who are actually looking at this. I had no idea.
Wow.
And so I contacted Jeff the next that week, and he was very kind and gracious, and he invited me up to his office. And I then spent about the next month and a half, every time I had a day off, I would go up and visit him, and started seeing patients and treating them with the things. He invited me to my first Defeat Autism Now conference. He then actually ended up with a back injury and had to stop seeing patients, and he sent about 50 patients my way in about 2 weeks.
Oh my goodness.
And then that's when things really kind of exploded, because next thing, not only was I willing and able, but then I had a patient load.
Wow.
And then, but it was interesting because as we would get one kid better, like the rest of the kids in that class or in the therapy group would coming, so then I ended up with a Miami pod, and I ended up with a Tampa pod and an Orlando pod. Next thing I know, I had like an Arizona pod, and I had a New Jersey pod, and I had a Venezuela pod,
Wow.
and it just really just started growing like that. And I'm like, how are you people finding me? It's like, it was really, really unexpected, and that's really how it started to grow. So that was like back in like 98, 99-ish. And then I went to my first conference up in Cherry Hill, and I'm like, oh my God, there's like a room full of doctors here. There's doctors from major universities here. This is like not by a fly by the night type of thing here. And so that really is what really got me going. And then of course success, you know, once I saw it was successful and that kids actually were getting better, these kids who were basically being told, you know, these kids will never amount to anything.
A
Go
lifelong condition.
Put your kid in a home. You know, there are a lot of the things that you've been through yourself, and I can't even imagine as a parent what that must be like to be told that, and that's just got to be like, you know, want you to like take my heart out of my chest and just stomp on it right in front of me because you basically just did that anyway. And you know, so it's interesting because I realized most of the physicians who do what we do did it because they had their own special needs child that they had to fix, and that's how they. And then when they got their kid doing better, then they opened themselves up to the rest of the world. And I kind of came about it from the opposite way. I was just interested in natural medicine. I was open-minded to exploring these things, and then things really were working better. And I'm like, oh wow! So after about a year, so I was really seeing those patients during my off hours. And as the patients were becoming more and more, I'm like, this is like a full-time job. I think the need is there that I really should just leave this large practice that I'm in and go out and have the opportunity to do this full-time. And so we did that. I think it was around 98-ish, 99-ish.
Wow.
So it's been like 13 years now that I've been doing biomedical therapy. So it's been a while now.
My goodness.
Yeah.
Now, and I heard, you know, when you speak, you talk a lot about the gut and cleaning up the gut.
Yeah.
Now I know what that means, but to our
Yes.
viewers out there, what does it mean to clean up the gut?
Okay. Well, I guess maybe we take that one step back and say, why is the gut not clean in the first place? Because we should start there. And, you know, in my primary care practice, because I do both primary care checkups and birth from a more holistic perspective. So these are issues I don't see in my primary care practice because my kids never went down this path in the first place. But like 99% of my patients are nursing at 6 to 9 months, and most of them are nursing well into their second year. We're not putting them on antibiotics all the time. So when you have good gut immunity, when your intestines are exposed to what it's supposed to be exposed to, i.e. human milk, as opposed to a formula that, I mean, like, we're the only mammal that puts another mammal's milk into our body in the first place, and we're also, furthermore, the only mammal that puts milk into our body after we've been weaned from the breast. And so humans were never intended to see milk. Not that I don't like ice cream every now and then too, but it's not something that our bodies were ever intended to see. And so this major allergen are put into the bodies of a lot of kids on a formula at the very beginning, and a lot of them can have problems with it. Kids end up on antibiotics and they get a lot of ear infections from the milk. And then a cycle starts. They kill off the good bacteria that's supposed to be in the intestines. Bad guys like Candida, Clostridia, which is a bacteria. Other things start to grow, and then there's no room for the good guys to come back. And then once that's there, they can take over. And especially, it seems, in the young children, the part of the immune system's job is to recognize this is your body, I'm leaving you alone. Unfortunately, people with autoimmune diseases, that's not what happens. And you are a foreign bacteria or virus, I'm going to attack you. Now, we know that our body, for instance, doesn't attack the acidophilus, the probiotics, the flora. It kind of leaves it alone. You know, one of the more interesting statistics that I